Thanks for staying with us. So joining us on the show is the Chairman Committee on COVID-19 Nigerian Medical Association, Lagos, Dr. Japhet Olugbogi. Dr. Japhet, are you there?
I'm here with you, Mariah.
Good to have you again. So we woke up this morning to news of the fact that 40 health workers are being infected with the virus, and that's quite worrisome. What is happening within the COVID-19 space? How are we protecting our health workers? Do they have enough PPEs and all that? Could you give us an update on what's going on, please?
Yeah, thank you very much, Mariah, once again for having me on your show. First of all, permit me to clear the air on the statement I made last time I was on TV. I would like to apologize to my medical record officer's colleagues, whom I erroneously said not to be one of the health workers. They are health workers. In fact, they are part and parcel of the health workforce. It was a statement made in error. It's not even like I don't know that they are, but I think the statement was made at the heat of the moment. So I profusely apologize to them. Now, back to the meat of the matter. Health workers are like soldiers, and you cannot send a soldier to the battle front without giving the soldier ammunition and body armor and helmets and boots and even uniforms. So health workers need PPE. They need adequate PPE. From the transmission of COVID-19, I've said it on TV many times, that health workers are the most at risk. And health workers are the ones that can spread the infection quite much more easily than any other set of people, because they have contact with these patients, and if, for God's sake, any one of them contracts the virus, they can spread the virus to other patients, they can spread the virus to their colleagues, they can spread the virus to their family members. And like I was trying to say the last time on TV, when you get through the gate, everybody in the health team is important. I always tell my team members, everybody is important. From the gate man to the doctor to whoever, to the attendant, to the cleaners, everybody is important. And everybody needs to use a PPE, some form of PPE or the other. That was what I said on TV the last time, and I'm saying it again. Everybody in the health sector, everybody that works in the hospital needs to use one form of PPE or the other. And then PPE must be provided for them by the end.
Right. All right, sir. Okay. Okay, so I want to understand the exact situation. Is it that there is enough PPEs, but they are not distributing to these healthcare professionals, or that the federal government does not even have enough PPEs? Because if we know where our problem is, we can now start devising means to solve it. What is the exact situation?
It's hard to say, really. It's hard to say, because I don't know exactly what is going on in other parts of the country. But in Lagos, I know that the state government says they have PPE, and we have seen that they may have some PPE. So I think getting it across to the health workers on time is still an issue, logistic problem. But in other states, in other parts of the country, I do not know for sure if there are adequate PPEs or not.
Right.
What we know is that whether there are adequate PPEs or not, health workers must be given adequate protection. Health workers will be given PPE. It's not just enough for us to say we are treating this COVID-19. Those 40 health workers that the minister mentioned, I am sure that they may just be more than 40 health workers that are infected with this virus already. So we need to be protected.
All right.
Japhet, I'm going to have to hold you responsible for the ones that happened in Lagos. And I'm saying this because you are the chairperson. You are in charge of COVID-19 and the doctors involved. Now, while I know some of the doctors might be from private hospitals, and I'd like to ask you a question concerning those ones and how they should get protected, the 3 confirmed cases from LASUT and General Hospital in Alimosho are members of your association. They are your people. So how did they fall through the loop? How was it possible that they got exposed while working to COVID-19, after all the education, after all the awareness, after the fact that we've heard over and over again that PPE has been provided for them? So in this one, you cannot say, it's not my place, it's not doctor, it is your place. What could you have done better?
Thank you very much for that question. As we all know, this virus is an invincible enemy. So whether you wear PPE at all in the first place, one can still contract the virus. There are various means by which the virus can infect somebody, and by that various means by which somebody can transmit the virus. But what we are saying is that when you wear PPE, or when you are sure that you have PPE to wear, or when you are sure that anytime you wear your PPE, you have this, at least, sense of security that at least you are safe. That wearing PPE does actually not mean that you cannot contract the virus. So the cases in Lassus and Limosho, we have all heard some of the stories. Some patients come to the hospital without disclosing their travel history, without disclosing their symptoms completely. And they want to hide from doctors. They want to hide from health workers that they actually have symptoms of COVID-19. I think that is what played out in many of these facilities.
Right.
Apart from that, some private hospitals were treating cases of COVID-19 in isolation without letting us know. And that was not what the government wanted, because even if they are equipped to manage cases, they are equipped to manage COVID-19 cases.
Right. So, Dr. Japhet,
infection prevention control update to be able to prevent infection from spreading to their civil health workers.
Right.
So, a quick addition to the question.
This was the avenue where most health workers got the virus.
Okay, the second part of my question was concerning the private hospitals. So we have about 11 hospitals have been declared shut down because of exposure to COVID-19. My worry is the doctors have also been exposed. They would expose family. It's going to spread. Who's responsible for providing PPEs for private hospitals? Is it the private hospitals, CMDs that you hold accountable, or is it the government that's supposed to provide all private hospitals and every doctor, every medical personnel PPEs? Who should we hold accountable for getting PPEs to private doctors too?
Thank you very much for your question. It's in two parts, and I will look at it from this perspective. From the onset, the NMA had been urging the federal government and the state government to provide PPE for all private hospitals. Now, this is because PPEs are now expensive to get. We don't manufacture most of them in Nigeria, even if we do manufacture one of them at all. We don't manufacture many of them in Nigeria. And so even if private hospitals have money to get, they may not be able to procure these PPEs easily. So we called on the federal government to provide PPEs to public hospitals and even private hospitals. At least I have been on TV clamoring for that on many occasions. Now, it is the responsibility of the MD of each hospital to find a way to provide PPE for their teaming health workers. Whether you get it from the government, whether you procure it, whether you manufacture it, it is not the issue. But each CMD, who is the Chief Executive Officer, who is the accounting officer of all the hospitals, should ensure that they get the adequate and minimally required PPE for their teaming health workers.
All right. I wanted to ask about the VIPs that have COVID-19, how we're managing them. Do we have a portion of IDH for VIPs, or those of them that are home, are we trying to encourage them, appeal to them to come to IDH, or how are we managing those VIPs that have COVID-19? Because we're getting it in the papers that many of them choose to be treated in their homes and thereby exposing family members and loved ones. So how would you react to the issue of the fact that VIPs choose to be treated from home?
There is no VIP in COVID-19 exposure. There's no VIP in COVID-19 treatment. There's no VIP in COVID-19 transmission. So we don't know. The EOC does not know COVID-19, and NMA does not know VIP in COVID-19. What we said, what the EOC wanted, what the EOC stipulated, that anybody that is a suspect case must be given samples. Samples must be taken from them, and then when they test positive, they must all be carted to the isolation center.
No, Japhet, that's not true.
I know that when the Prime Minister of the UK got the virus, he was in his house, he was treated from home. When the governor of Kaduna State, they were treated from home. My point is...
The policy is even self-isolate, unless you now become... Or even if
they were confirmed, both of them were confirmed. Yes. They're actually positive. So the point is that, so my question to you is that, must they go to the isolation center or to the infection disease center, or they can actually be treated from home. We need clarity on that because we're feeling that there's a two-way street here.
That's the point I was making.
Right.
I was telling you that the EOC, the NCDC guideline does not say anybody should be managed at home. Everybody that has COVID-19 should be taken to the isolation center and managed there. That's the guideline.
Now, Japhet, that's a new information.
Whether some VIP are being treated at home or not, it's a different game, it's a different issue entirely. And we are aware that some people are being treated at home, but we discourage that. Because the more you stay at home to be treated, the more you transmit this infection to others. The guideline says that everybody that tests positive should be taken to the isolation center. Of course, I'm also aware that some VIPs refuse to go to the isolation center. Some VIPs prefer to be treated at home, but that is not what the guideline says.
Even if they are asymptomatic?
Yes, that's a very brilliant question. Thank you very much for that. It's unfortunate what has happened in Kano, and we are all praying and hoping that they can rise up to the occasion again very soon. In Lagos here, we are already anticipating that as nobody is immune to the virus, as nobody can be too equipped to contract the virus. Even I personally want to take the test because I've been exposed. I feel I've been exposed a couple of times, so I want to take the test. Now, the EOC already anticipated something like that happening, and I'm not at liberty to disclose what they are doing or what they are planning, but I know that there is a plan in motion to bring in people. They have volunteers who have been listed. They're already calling them. So they have enough hands on deck that even if any one of the members of the lab or case management has the virus, another person will come on board and continue from where they stop.
A quick question, sir. So there's this conspiracy theory that people who test positive are those who actually go for the tests. That those who do not take the test at all, we've not had cases of people just dying in their houses from coronavirus. So it's when you take the test that there's likely something that will happen and some will have it and others will not have it. Just help us clear the air, please. It's outside there.
No, that's absolutely not true. Don't forget that we did active case search, or we are doing active case search, and we have visited over 800,000 households. Okay. Out of these 800,000 households, we picked about 1,400 who had symptoms that are similar to COVID-19. And we tested all of them. And just 3 or 4 or 5 of them came out to be positive. So it is not
test that's causing it. I have to let you go, Dr. Japhet, but I can't let you go without asking this final question. The doctors from China, they've done their 14 days. Now they're out. Are they coming to Lagos State, IDH? Are they coming to see our patients? Or what's the plan with them on your own end?
Morayo, I think we should be asking the Minister of Health that question.
Okay. Just check. You dodge. So Nigerians are monitoring these doctors where they are going, everywhere they go. As they're eating breakfast, they're monitoring them.
I know.
Okay, no worries. Thank you so much, Dr. Japhet, for joining us this morning.
For having me.
We've been speaking with the Chairman Committee on COVID-19, Nigeria Medical Association, Lagos Chapter, Dr. Japhet Olugbegi. Let's go on a break. When we come back, our hot topic. Stay with us. We'll be right back.